and Wellbeing Board meeting on Thursday, 10th of April at 10 a.m. The usual caution that we are being audio taped as well as video taped. The camera might fall on your laptop or mobile phone screen, so please be aware of that. And there is a special announcement. I think we are in a pre-election period, so therefore we should refrain from politically sensitive topics or talks and chats. It's not that we ever been political in this board, but nevertheless it is best to, it's my duty to remind you. And we have two major items. So let us begin with, sorry, you can start recording. Let us begin with each one of us introducing ourselves. That is the custom, even though we all know most of each other. So I'm Paul Egil-Shelvan, Councillor for Cramlington Southeast, which I chair this meeting.
Good morning, Graham Sayers. I'm a GP in Alnwick. I'm a clinical lead with the local delivery team of the ICB.
Veronica Jones, County Councillor for Ponteland West, but the portfolio holder for improving public health and tackling inequalities.
Morning everyone, Jill O'Neill, Executive Director Public Health.
Morning everyone, Simon Nielsen, I'm the Executive Director for Place and Regeneration.
Hi, it's Paul Jones, I'm the Director of Environment and Transport at the County Council.
Hi, Neil Bradley, I'm the Executive Director for Adult Services at the Council.
Hi, good morning, Peter Stanfield, I'm the Chair of Health Watch Northumberland.
Good morning everyone, I'm Jeff Watson, I'm the Council Member for Amble Westworth Warkworth, and I'm also the portfolio holder for Healthy Lives.
Good morning, Sharon Williams. I'm a pharmacist and I'm representing Community Pharmacy North of Tyne.
Hi, Russ Wiggum. I'm an Exec Director at Northumbria Healthcare.
Good morning, I'm Laura Jobson. I'm here on behalf of Chloe Mann this morning representing CNTW.
Good morning, I'm Kevin Waring, Police Superintendent for Northumberland.
Good morning, I'm Janet Harris, Deputy Director for Delivery in the ICB, and I'm here on behalf of Rachel Mitchison.
Good morning, Abby Conway, Chief Exec of Citizens Advice, representing the voluntary sector through Thriving Together.
Good morning everyone, my name is Janelle Clough and I'm the community anchor within the Growing Healthy 0 to 19 service.
Morning everyone, I'm Sam Anderson, I'm one of the service managers for Growing Healthy 0 to 19.
Andrea Todd, Democratic Services.
Let's move on to the first item, apologies for absence.
Chair, we have apologies from Vicky McFarlane-Reid, Councillor Sanderson and Councillor Purvis.
Okay, thank you. Item 2, to agree the minutes of 13th February 2025 as a true record. Is that okay? Thank you. Thank you very much. Item 3, disclosures of interest. Right. Does any member have any interest to disclose which they haven't previously disclosed? There are 2 items, and report of the cabinet member for tackling inequalities, and 0 to 19, growing healthy and Northumberland summary report. Is there anything? No. Well then, we will be moving on to the first item, report of the cabinet member on for tackling inequality, a special update on building blocks of a good life, which is one of the 4 themes of health and well-being strategy. And Veronica will be introducing, and Paul and Simon would be presenting.
Thank you, Chair. So the Health and Wellbeing Board holds the responsibility for the Joint Health and Wellbeing Strategy. The building blocks of a good life is one of the themes of the strategy, and this is an annual update of the theme to assure ourselves of how it's progressing against the strategy. We used to call this the wider determinants of health, that is the issues that affect people's health and well-being, that's not just the NHS. bit of a confusing title, and building blocks really fits it better. These include, amongst others, housing, education, transport, employment, etc. So this work has involved many different parts of the council, and although the report itself is from Public Health, things just went off. Officers from the other teams in the council are here this morning because it's their report too. There's been participation too from other partners here in the Health and Wellbeing Board, the County Partnership, and from the NHS business, voluntary sector and others. We're not here as a scrutiny role, it's our strategy. Scrutiny is the role of the Overview and Scrutiny Committee, who are able to look at any issues involving health. Today is about our own assurance of our own strategy. Simon Nielsen, who's our Executive Director of Place and Regeneration, is going to present the report. So thank you, Simon.
Thank you, Councillor. Thanks, Chair. So firstly, pleasure to be here. I know many people in the room from some of the events that we've been involved in along the way with this work. And some people may have heard me say this before. In a previous Exec Director role in another authority, I was responsible for public health for 4 years of my tenure there, and it's a profession and an area of focus which is very close to my heart as well. So it's great to be working alongside Jill, Neil, Audrey and other Exec Directors to ensure that we play our role across the various responsibilities that we hold. 14 pages doesn't kind of cover how much work has happened, so well done to Luke for getting it to that brevity level. Wanted to spotlight a few things in particular today for Health and Wellbeing Board members. Firstly, many places around the country will claim they're doing this well, but what they typically do is shoehorn in wider determinants or building blocks and pretend that work is therefore contributing to the work of the Health and Wellbeing Strategy. This place, our place, does it properly, wholeheartedly, very intentionally, and I'm proud of the role that we've played as a directorate across the responsibilities that we hold of how well we've got into the work and opened ourselves up to some of the challenges, sometimes very challenging areas that we need to, particularly around housing, for example. So pleased to be able to provide the report to sort of spotlight the great strides we're making across particularly housing and planning and economic development, regeneration. Then Paul will cover what we're doing around transport, which is an area of focus yet to come in the work plan. Firstly, on housing and planning, just a few things to call out which sort of demonstrate the commitment that I spoke about. So the first is the Housing Inequalities event that we shared with partners, and that shared determination last summer to construct a housing strategy for the entire county, for the place and places of Northumberland, rather than for the functions and individual agencies responsible for the various parts of the housing system. And that work is well underway together. We ourselves, as the local planning authority, are evaluating our local plan right now. What can we do better next time? Where are we on delivery? What does that mean in context of new government targets for housing? What does that mean for employment opportunities to come? And how the work of this board and our partnership will lead to different choices about the type and tenure of housing developments that we want to see, and in particular specialist housing that we desperately need, which I'll turn to in a second as well. Really pleased to see the health impact assessment work having a major effect on decisions elsewhere in the county councils. Also, for example, in planning, where we took the QTS hyperscale data centre campus to planning just last month. Unanimous support from the Plan Committee in this very room. However, again, some very challenging parts of the health impact assessment, quite rightly, to point the way to us and our partners in building out that scheme of what we need to pay attention to, so we ensure that that provides as best impact as we can within the county. Developments that we're personally responsible for as a county council, things like Hexham Middle School, where we've taken the healthy housing approach to master planning an area and looking at what the best outcome for that area is in combination with the town it will be part of, rather than a traditional sell to the development market and see what comes back. So I'm really pleased that we've held that responsibility well. Specialist housing that I mentioned, it's not reported in this work, but particular work that we're doing through Councillor Patterson and Neil's responsibilities in Linden Walk for dementia-friendly bungalows, which will this summer see the first tenants occupying those schemes. I went a couple of weeks ago to see progress on the ground there. Housing deprivation and warmer homes. Paul will cover a lot of that, and an award-winning team doing lots of great work and securing a lot of money to support our development there as well. Selective licensing, which is called out in the paper, our determination as an entire county partnership to tackle entrenched deprivation in the Hurst in Ashington, and the community conversations happening right now with Hurst residents about what they want to see for the future of their place. And then the place standard tool to complete the set. It's a tool that has been well worked and well used in towns for borderlands schemes, for example. We've also filled in the gaps where we don't have funding attached to places like Cramlington and used the place standard tool there. And when we as a county council had the peer review team in last year, they commented on leading edge practice that we're demonstrating through the use of that tool as the opening conversation with communities about what they want and what the challenges and opportunities of their area are, and then how as we as public agencies follow those through with plans, policies and funding to come. On regeneration and economic development, less to say on that because that work is still developing, but a small number of areas to focus on. That will be spotlighted in the inequalities event in June, which I noticed the request to attend went out yesterday to partners, so look out for that in your inbox and do come along to that event. That promises to be a fantastic opportunity to consider the role of employment in health and better outcomes for our residents. But it is building on some fantastic work today, and again, two things briefly mentioned in the paper but are spectacularly successful through Audrey's work within Northumberland Skills in particular. So the Welding Centre at the Port of Blythe, together with next door the Energy Central Learning Campus, which opened in September to learners. I spent a couple of afternoons there last weekend, just brilliant work happening, industry-led placements for students on T-levels who are being snapped up by businesses working on the port because they're seeing the skills and attitude of young people coming into that centre in a fantastic learning environment, and they can see the stars of the future for their workforce, and they're grabbing them with both hands, metaphorically. How we attract and land substantial investment, so QTS mentioned from a planning perspective, but it's hugely important we exploit any inward investment into the county to ensure that we reduce inequalities through those investments rather than potentially compound inequality. So the local supply of employment within 25 miles of that site is really crucial to ensuring the success for both Northumbrians and the wider North East as well. And then the final thing on economic development, I think, is a spotlight for the future. We need to pay attention to the role of the North East Combined Authority, in particular when it is given a single settlement from government, where there will be more local determination of policy areas where money is spent and at what level, rather than the current system where there's lots of fixed pots of money which are directed to certain outcomes, certain outputs, and all with slightly different governance attached to them. The fact the North East will have a single settlement of however many hundreds of millions to determine how it is spent in the years ahead puts us in a good position as a county, puts this board in a good position to influence very strongly what works for outcomes, for employment, what works to reduce inequality and produce healthier lives and a healthier county. And we can play a longer, stronger role in that work in the North East in future. On transport, Paul will cover the majority. I just wanted to say two quick things. One, just because I'm immensely proud of our team, of the work we've done on the Northumberland line, opening in December, nearly 250,000 passengers through already, 3 more stations to come. In itself, a huge infrastructure project and an engineering challenge, but the opportunity it provides to South East Northumberland and the opportunities we're already seeing of social mobility, of better job opportunities, of better leisure opportunities, better family connections and other social connections because of that line, at importantly an affordable price. It is a very well priced ticket, so do use it, and we will be looking to improve rolling stock and other opportunities when possible funding opportunities come forward. And then again on North East Combined Authority, a lot of work going on at the moment on bus reform, what that might mean for more local control of buses at a North East level. That was a political commitment of the elected mayor for the North East. We have to play our role very carefully in that because we are a rural county along with Durham and part of Gateshead, where our dependency on bus services in rural areas is more acute than it is in the more urban areas of the North East. So we have an officer from one of Paul's teams embedded in the North East Command Authority team looking at what that looks like, how that will operate, how we protect investment in rural bus services for the outcomes that I've described, but also, frankly, it's really important to homeschool transport in a rural area like Northumberland as well. So hugely proud of the work we've done, hugely proud we're focusing on the things that we are right now in regeneration and economic development, and then transport to come. So Paul can touch on both warmer homes and the rest of the transport set. Thank you, Chair.
Warmer homes aspects, my responsibilities for the Council's climate change team, and obviously we see climate change as being one of the key issues that really affects inequality within the county as well. And that is something where, as with a lot of these issues, there are many core benefits. Once you start tackling one aspect of that, you can then tackle many other of the key determinants of health as part of that. So the team, when we're working, really do focus on helping the most vulnerable elements within the county. So we'll look at particularly targeting off-gas grid homes, those that have got very poor energy efficiency rating, but also low income, that are in fuel poverty. And we work collaboratively with other organisations, both within the departments within the County Council, but also external organisations and the VCS. So as you'll see from the paper, there's been work undertaken to develop the Warmer Homes Coalition, which is a partnership arrangement that shares best practice, looks at how we can provide that data and intelligence, work collaboratively and try and target who can support best the individuals that come in through the various routes to those organisations. In terms of our own internal Warmer Homes team, we established a dedicated Warmer Homes team a couple of years ago now. That team basically has been extremely successful in getting a whole jigsaw of external grant funding pulled together to support people that are in most desperate need, in effect, within the county. And you'll see from within the report, in the last couple of years, they've supported over 400 homes with a variety of kind of fabric-first approach, where we send in our own retrofit assessors. They look at the actual fabric of the property, that make sure that the measures that we're putting in place are best suited to those individuals, that they won't put them in other difficulties in terms of paying for electricity and things such as that. So it's a range of things such as changing their heating arrangements, putting solar panels on, changing windows, looking at insulation measures within the home, but most importantly also looking at ventilation. And you'll see there's been a lot of issues of late highlighting damp and mould within properties and the significant impacts that can have on the health of people living within those homes. That is something that is key to the work that we do as well. So there's a lot of work goes on in terms of that, and all of the work that the team does meets the standards in terms of past 2035 for ventilation as part of the grant schemes that we work to. Going forward, the team have also just recently started working with both Northumbria University and Cambridge University on a 3-year research project, which is looking at the damp and mould issues within properties. So we're working with those key institutions on a wide research project that basically puts in some really cutting-edge monitoring equipment in households that uses AI to help analyse that data, that's basically trying to look at predictive modelling, so they can look at how in advance, if the conditions within a property are likely to stimulate damp and mould growth, and then how you can affect the heating systems and the ventilation systems within those premises to avoid that from becoming a problem. So clearly that's something that will bear significant fruits, we hope, at the end of that, and really help share best practice across the UK that we're really at the heart of, which is, I think, a credit to the team. The team has been recognised nationally. We have been working with the VCS sector in particular within the county, providing that support and guidance to people that are most vulnerable. And that is something that we have been recognised nationally as being best practice. The team has won various awards of late in respect of that. Most recently, the team's also taken forward the latest round of government funding availability. So we've put in successful bids. Unfortunately, due to the pressures on government funding, the level of funding that we were seeking, we haven't been able to secure the full amount that we were after, but we've still managed to deliver as part of that programme the local authority grant funding of over £2.5 million that's coming into the council for for the next 3 years. That's targeting effectively privately owned properties that are most vulnerable, so below EPC C rating, on low incomes, also private rented for the first time as well. Private rented is part of that arrangement. So we're looking to support at least 140 homes to lift them out of those EPC ratings to minimum EPC B, or B rather. Going forward, we're also have been successful as part of a consortium approach with the North Eastern Yorkshire Net Zero Hub, that we're working with a range of other organisations in that consortium bid, and have secured a further £3.5 million through the government's programmes to tackle our own social housing stock within the county. So that's the county council's own social housing stock. Other organisations such as Carbon and Benicia are also part of that consortium and have been successful. So that's a really good news story for Northumberland in terms of that key element. As part of that bid, we were required to support that with match funding, and we were able to support that with over 3.5 million rather in HRA match funding to support that bid. There is more available there as well that we can take forward. So if, as part of that consortium approach, some of the partners aren't able to fully utilise their bid, one of the key benefits of being in that consortium arrangement is that we can effectively mop up any slack in that system, and the team are really well placed to do that. So we'll be looking to support a further 460 homes to take forward energy efficiency measures going forward in the next 3 years in our own social housing stock as well. So I think really positive direction of travel on the warm homes front in Northumberland, and continuing that good practice going forward with that. In terms of the transport arrangements, I think first thing, the transport clearly is a critical enabler to having a healthier life and tackling wellbeing issues. It does provide access to education, employment, leisure services, and I think also fundamentally it enables people to live more active and healthier lifestyles, which again is a key issue in terms of a determinant of health. So within the report you'll see it makes reference to the North East Local Transport Plan that has now been adopted. The North East Local Transport Plan is something that our teams have fed in directly and have shaped how that's gone forward. Within that North East Transport Plan, the key objectives are to deliver a greener, safer, more reliable and accessible transport network to the public. And that's both physically more accessible as well as financially more accessible. So those are all key things that the County Council wholeheartedly supports and has already been taken forward in its own transport programming and activities. So some of the things within that is about improving journey planning, so people have better access to information to enable them to plan journeys. Some of that will include digital timetabling and things such as that out and about around the county. It's also looking at ticketing and fares to make sure that the ticketing is as accessible as possible. You can have intermodal fares between different forms of transport as well. It's something that we want to take forward as part of that. So you'll be well aware of the current ticketing and fare arrangements. The £1 youth transport arrangement has been massively successful, as has the £2.50 bus fare that's going to continue for the rest of 2025. But we are also looking at active travel, a really big focus around active travel, and also safety issues, particularly for women and girls on public transport systems. So as part of that, in terms of the Northumberland line as an example, all of the stations have CCTV on them. That is monitored and that is tied into response as part of those issues as well as having well-lit car parks that are designed to try and design out crime, so that there's no place where people can hide and jump out on you in places such as that, so people feel more comfortable and safe using those facilities. The other thing that's mentioned in the report is around the local cycling walking improvement programme, and again the Cabinet within the County Council agreed the LCWIP programme just recently in April. That's now effectively signed off the 12 main towns and active travel corridors that have been identified in those 12 main towns, that looks to try and effectively link up and improve the infrastructure within those locations for those short journeys, so less than 2.5 miles, that tie into basically where people want to get to and from within the main towns. So it is things like how you get into the town centres, how do you access the schools, how do you get to the key services and the key employment institutions, the key leisure facilities within those communities, and ideally making them much more easy and safer to either use for pedestrians to get to, and also people for wheeled access, either on scooters, push bikes, or mobility scooters and things such as that. So again, that's something that we've now identified and taken forward, those active travel corridors. We've already been working hard to deliver a lot of those improvements, and it is something that, because of the cost and the complexity of those projects, we look at a bit of a patchwork quilt in terms of funding and opportunities. So what we're actively doing is basically designing up schemes, taking forward that work effectively at our own risk, so that those schemes are then on the shelf, and rather than waiting for funding opportunities to come and then looking at how we can deliver schemes against those, we've got the schemes and we're looking at the funding opportunities the other way around, so that we basically have shovel-ready schemes ready to go that are much more a higher prospect of securing that external funding. So there has been some really good successes, and I think no surprise that those areas also tie into the areas that generally have the highest level of deprivation as well. So a lot of the work that we've been undertaking to date has been in the likes of Ashington and Blythe, where we've been improving the active travel corridors in those locations. There's work ongoing in Bedlington at the moment that connects Bedlington town centre to the various schools, as well as other key destinations, and ends up towards the coast at Camis, that connects both the new rail stations, but also the new big employment sites at QTS as part of that. So again, it's just delivering that accessibility to employment, accessibility to leisure, accessibility to education that's really key in terms of improving people's life chances going forward. We also have schemes in Hexham and Corbridge that we're looking to develop. That's going to be it's on the ground at the moment, just doing some initial preparatory work that connects Hexham to Corbridge. A lot of that work is actually within Hexham itself, so it's connecting effectively the east end of Hexham, past the hospital, past the school sites, into the town centre and also the station. So again, you can see the key kind of themes on all of those investments. It's connecting those key education, leisure, service centres, potential employment opportunities to the areas that are the most deprived within the county, that opens up those life chances for people going forward. As well as that infrastructure aspect, it's also behaviour change is really important. So we do a lot of work within schools and with young people. So that includes programmes such as the Bikeability, that's basically training people on how to safely ride a bike, which, you know, isn't something that for some people comes naturally, especially on busy roads. We're also working closely with schools in terms of the mode shift stars, and that's about getting young people basically out of cars and giving parents the confidence and the comfort and the reassurance that it is safe to get to and from school. And some of those schemes have been really massively successful, and there's an example within the report of the Stannington school where literally it used to be an absolute log jam every morning and every late afternoon when kids were getting dropped off and picked up, and now it's literally a car-free zone, and it's a far more pleasant experience for the children to do that. They experience in nature, having health and having those healthy conversations and contact with each other as part of that process. So it does have a massive benefit over and above what we're trying to drive in terms of that transport improvement as part of that. The big areas of activity going forward will be the ongoing bus reform, as Simon said. That is a big area of activity for us, as is the active travel corridors, and it is something that we're constantly looking at to make sure that we are getting the best out of the new regional transport arrangements, that it basically serves Northumberland as part of that, and looking at that as a positive opportunity going forward. Thank you.
Thank you very much. A good comprehensive report covering 3 themes: housing, economy, and transport. Thank you very much. And I really appreciate when Simon said we go after the potential investors and make sure they invest in our area, because inward investment is one of the ways to tackle inequalities. And KMIS, the data center, is a real jewel in the crown in what we have done so far. Thank you very much. Now, I think as a committee, we are supposed to note these actions and make comments, recommendations. So I leave the floor to open for questions, comments, and recommendations. Yeah, Jeff.
First of all, I think they're fantastic reports, very comprehensive. But just for the rest of the board, we've got 4 executive directors, plus our financial expert. There's 3 of them here at this meeting. It shows you how important that we feel the subject is. And at I can assure you, at every meeting that we have, every cabinet meeting, every senior leadership team, one of the things that's always discussed is inequalities. Every one of our officers is absolutely dyed in the veins of inequalities, and it comes up all the time, every action we take. And I am assured by that, and I'm even more assured by what I've heard this morning. I think, thank you. Thank you very much, officers.
Yeah, thank you, Jeff. That's a very important point. We are all focused on tackling inequalities. Thank you very much. You want to come in?
It's really I'm pleased Jeff said that. I was thinking, how have we got from where we were probably 4 or 5 years ago with the board to a really comprehensive report which covers so many different things, which I think everybody in the room probably has an intrinsic knowledge of why those things have been mentioned and what our role has been. But just to kind of refresh that, we all signed an inequalities thing here, and that set a value about what we were trying to do. And alongside that, we also made a point of saying, but it's about the residents' voice and communities first. So to hear Simon mention the place-based tool was something that we latched onto to do with the discussions that we had here. We refreshed the health and wellbeing strategy, and I think in that refresh, because we'd set the values that we wanted it to reflect, that refreshed document, which I still go back to on a regular basis, because it gives me the confidence to then go to other people and say, look, what you're doing here sits in here. So then all of the organisations that are in this room, I think, because of all the work and the conversations that we've had, can then say to their organisations, this is what the Health and Wellbeing Board are doing, and this is the impact it is going to have on the inequalities of Northumberland. And I think we have that voice now. My next point was, let's not be complacent with that, because we could sit back and say, well, it's all going to happen now. And it won't, because actually we have to just keep going and keep going. So I was trying to think, is there anything else that I can challenge ourselves with to do beyond what we've just heard? And just now, I can't put the words to that, but I think we should all think carefully about how we do that. And I think how we build on the work from the Institute of Health Equity and where the employment side of things goes, for me, feels really important. So thank you.
Thank you, Grant.
If I may, just on that final comment, I think the power that we have in Northumberland and through this mechanism is there will be a temptation. I've been involved in a regional authority elsewhere in the country. There will be a temptation to standardise most things across a region because it makes sense if you look from a regional perspective down. But that might not work for our employment work, where we have specific needs in this county which are different to those in Newcastle or North Tyneside or other areas. And it might be our strength is we do things differently here and model them for the rest of the region to then follow or adapt and adjust as we go. And I think we are in a very strong position, given that history, to make that plea. What we don't want to happen, I'm not suggesting it will, but what we don't want to happen is good work that we do is sort of watered down by a standard approach. That's not the right thing to do. And you've got our commitment that we will make sure that we get the right thing for Northumberland, not the standard thing that makes sense for others.
Correctly, so there may be a standard approach imposed top down that might undermine what we are trying to do or what we are trying to build on what we have done. So, yeah, it's something that's a good point to note, yeah, because the standard approach may not fit, because it assumes one shoe, what's the saying? One shoe fit all size or something, yeah, okay. Thank you. Are there any comments? Yeah, this is the time for comments. Yes, please, Neil.
Yeah. Thank you, Chair. Yeah, I mean, it was just to embellish some of the points that I think Simon made when he first started talking. I mean, as one of the longer standing officers in the council, I think back to 5, certainly 10 years ago, when I had huge levels of frustration sat in adult social care, seeing pockets of land going out for development and finding out about that after the event. Planning decisions being made, not necessarily in line with what we ideally would have liked to have seen from an adult social care perspective. Wendy and I had the pleasure yesterday lunchtime of sitting in our quarterly TAP board, Targeted Accommodation Board, where we have a run through the massive projects that we've got going on at the minute around extra care housing developments and specialist housing developments. And in that meeting with us, we're planning, housing and strategic estates hand in hand, helping us to develop the projects, making sure we didn't miss opportunities for pockets of land that were coming up for development and things like that, and a really high quality discussion. I think within the council, the whole mood music's changed, and certainly in the last 2 years, as to the level of cohesive working. And I can feel that starting to come across the wider public sector group as well. You know, we're involved in conversations with the Trust about developments in Blythe and things like that as well. I think it's just really key in this forum that we continue to use that wider set of knowledge, base, ability and assets to keep development going forward. I think we've got momentum that I haven't seen since I came back to Northumberland in 2007 at the minute. And it's really quite refreshing. And I mean, I must admit, Wendy and I come out with a smile on our face every time on that 3-month update that we get on those projects. And it's a huge list that we've got going forward. And that barely scratches the surface of what's going on around the wider region. So it's just a big positive for me, and just endorsing what's been said there. It's a really quite exciting time for Northumberland, I think, going forward.
Thank you, Neil. Thank you, Neil. Jill, you want to come in?
Thanks, Chair. Just a couple of comments from me. First of all, I really want to thank Simon and Paul for their contribution and the wider team. This doesn't happen everywhere, and I've worked in a number of local authorities, attended various health and wellbeing boards over my career, and as Simon said at the beginning, sometimes it can feel quite tokenistic, that relationship across the wider determinants, but as Veronica says, thinking about the building blocks for a good life and how fundamental this work is, to have this as a real priority. It isn't just an add-on, it's not an extra to do, it feels core to us in the local authority, but core in Simon's part of the world as well, which is fantastic. But also bringing it into the Health and Wellbeing Board, we know as a local authority the work that has happened in this report isn't in isolation, it is all of the work. I'm thinking, for example, the voluntary sector and the warmer homes work, it's all of the work that we're doing with CAN, in the rural areas, so it is about all of us connecting it together to create that whole. And the more that we, I suppose, develop, and as you've just said, Graham, it feels like a mature partnership now as a Health and Wellbeing Board. It feels like we can have fair and honest conversations. If things aren't working, we can call it out, and I think that's really important, that if we're sitting here and we're missing something, we need to be told, because it isn't deliberate. It's because we just haven't had sight of it, and we will adapt and change, because it's all about working collectively. And just in relation to the housing work, obviously we've been really majoring on that for now. The report is being finalised, so it's not that you've missed the final report. It did come into the county partnership in March, so the Institute are just finalising it based on our last lot of recommendations going in, so that should be due out at the beginning of May, so everyone will have sight of that, and that is going into our overarching housing strategy as part of the consultation work. And finally, we do, as you've just said, Simon, we've got the 25th of June for the employment piece. I hope everyone will be there, and plus your wider colleagues, because again, we can only do this together. So thank you very much for coming today.
Yeah. Thank you. You have a question, Peter. Yes.
Well, it's not so much a question, more an observation, I think, but thank you for the work. You probably know, or some of the colleagues we know have been following the IHE work quite closely, and it does interests me enormously, and it's a fantastic piece of work. So congratulations, and congratulations to Luke for condensing the wide range of that work down into this report. I just fear there might be a risk, though, because there is so much that's going on, and it is county-wide. when I read the report, I just didn't quite get the sense of all the activity that is going on. I know it's happening, but we may be missing an opportunity by not reflecting it, because a lot of the examples did feel concentrated in the major towns and the sort of southeast Northumberland, and perhaps we could be trumpeting more the work that is going on to impact the inequalities suffered more by those in more remote communities.
Okay, so you are saying, you know, more focus is needed on rural communities.
Not so much focus, perhaps. I think there is a focus.
There is a focus, but it's not coming out.
I do think the strategy's got it right, and thank you for mentioning it, Graham, the residents' voice is built into the strategy, and it is kind of coming through. Yeah. But it is tempting to go with the quantity that we can, the quantitative approach in those areas where there is most to count, and the qualitative impact in those areas where perhaps it's having an even bigger individual impact.
Right.
We could lose sight of if we're not careful.
Okay, thank you. Thank you. You want? Yeah. And there's Abby. So yes, Abby, please.
I think just following on from that, I think it is really difficult to condense a lot of the work that is going on, but I think it's worth noting that the role of the local authority and certainly in the representing is to be that enabler of work, and in terms of enabling the wider section. It's very difficult, but some of the report, you know, it focuses very much on what the local authority's done. I think what we need to do going forward is actually understand that wider piece of work, because it's not the hundreds, it's the thousands, and we could be reporting that and in a way that's even more exciting, really. I think that would just be my request for going forward, is actually and comparing and contrasting the different work in a similar way to sort of understand. I think the point you were making, Paul, about best practice and about how do we do that, and it also reflects the customer, the community's first approach, which is, you know, where is it best left to communities and other organisations, and where does the role of the local authority? I think that's where we get to a really exciting place about what really works for Northumberland, and like you were saying, Simon, not this kind of vanilla approach or something, like, you know, that it's actually, and then we can really impact on those inequalities that we see and that we are all trying to address.
Sure. Point taken, I think. Yes, Simon, please.
Perhaps just to collect those two observations together, I think they're very well made, and particularly the rural side, I think we probably do more there than we say we do in partnership, and maybe something I can take away and Jill and I can work through is our leader is chair of the regional approach on environment, coastal and rural for the combined authority, and that's a portfolio that Northumberland holds and holds very dear. And there is a lot of work going on there about inequality in rural areas as well. So maybe there's something about that wider regional side that we need to show more together with the work. But I think the IHE work, as it comes through in each of the segments, will give us more of that wider perspective of all of the stuff that's happening from an independent voice rather than one or two of the partners describing the work that's happening. So I think that hopefully will be a bit more powerful as well to explain that. Thank you.
Thank you. Jeff, you want to
come back and say, I totally agree and understand with what you were saying. I represent a rural ward up in Warkworth and Amble. I could have added to all this today and made it brought a lot longer about talking about what we're doing with our libraries, for example. 31 libraries across the county. I could embellish it with the 10 leisure centres, again, across the county. I could embellish it by telling you about the £250,000 library van that we've just bought that goes out into the whole thing. The thing about Northumberland is one size doesn't fit all.
Yes,
it's a different requirement in Bedlington than it is in Berwick, and different requirement in you know, some of the really outlying areas need a completely different approach. And I totally agree with you that we need to, well, how can I put it, look after both sections of our community.
Yes, thank you, Jeff. I think if I recall correctly, in many of our closed sessions, we always had the thing in the back of our mind. Our county is quite diverse, lots of rural as well as urban areas, and I still remember Graham telling there are pockets of poverty, inequality in rural areas as well. So we have always been aware of it, you know, that diversity and the need to address rural as well as urban areas as well. Yeah, that's taken. But anyway, the point is taken on board. It's a good point, right? Any other comments, suggestions, recommendations? Okay, thank you very much, Simon and Paul. Thank you. Wonderful presentation. Thank you.
Thank you for having us. Thanks.
Yeah. Right. So now we move on to the fifth item, 0 to 9, Growing Healthy, Northumberland Summary Report by Samantha Anderson and Janelle Clow. Correct?
Thank you, Chair.
US.
Thank you. Is it working? No. Of course. Thank you very much for inviting us. We're here today, obviously, just to discuss our last 12-month summary plan. Ashley Ison just wants to send apologies, who is our head of nurse, and she couldn't make it today. So you've got the A-team, that's what we call ourselves, Janelle and I. So as you will know, in 2021, Harrogate District Foundation Trust took over the commissioning agreement with regards to the 0 to 19 service. And the Healthy Families Plan was presented a couple of months ago within this Health and Wellbeing Board. Since 2021, there's been huge transformation of the service. We have new data reporting systems. We're working really closely with our public health team. Staff have had and been offered lots of appropriate training to develop the service, and we have set up patient user feedback systems to really develop the service forward, to listen to what Northumberland really require. And I think a point that was taken earlier around we work in such a diverse community is absolutely been taken on board, because you're right, what is appropriate in some of our rural areas isn't appropriate for our more urban areas. We have delivered over the last 12 months over 11,000 mandated contacts to children in Northumberland, and the service continued to contribute towards the joint health and wellbeing strategy. This is an overview of our structure that we have within the service at the moment. I'm sure this presentation will be shared, so everyone can have a look at it in more depth. But as you can see, we offer a whole service to the whole of 0 to 19 and 25 for those with additional needs. So a few of the key updates to talk about today. So the mandated contacts. So we continue to deliver our mandated contacts. We did change the timescales, as we presented a couple of months ago, to fit in very well with the national and clinical guidance and evidence-based practice. These are our time scales and our mandated contacts available. Our target is at 90%, and as you can see, we have achieved consistently to those targets. We continue at our mandated contacts to complete home environment assessment questionnaires, and we're working in collaboration with the fire service, which we've continued to do over the last 12 months, to offer an enhanced assessment, so really identifying safety needs within the home and working with the fire service to do safety visits, sometimes jointly or sometimes separately. So from an early years perspective, the key updates over the last 12 months have been all of our staff have been trained in newborn behavioural observation. We've worked alongside the family hubs, but all our health visitors now are trained in this assessment. It's been really successful. We've been able to offer identification of early delay in development and worked really with primary care around issues that we have identified. Speech and language development. So ELIM is now something that's embedded within speech and language development. It's national guidelines. We've actually training staff from this month in something called ELIM-I, which is an additional intervention around speech and language development. And we're working with speech and language team in Northumberland around developing pathways. So the 0 to 19 service will be able to offer additional speech and language, really early intervention, which is evidence-based, and it will fit within the Northumbria speech and language pathway. Eyes on the Baby, so the whole of Northumberland was part of a pilot, and there are some services within this room today that I know has been part of the Eyes on the Baby training, and as a service we are accredited to 2 and 3, which is the highest accreditation that you can get from the Eyes on the Baby training. We were part of an evaluation project, and we're utilising this very much for safe sleeping, identification of safety again, misuse of alcohol, etc. So it's been really beneficial to staff to be able to bring these into their mandated contacts. And I think something that we're really pleased to have reintroduced is a 3 to 4 month development assessment. So this isn't a mandated contact if you look at the Healthy Child programme, but within Northumberland we've agreed that we'll reintroduce this contact, really focusing on emotional well-being and development, really looking at infant feeding, weaning and promotion of immunisations. We've also implemented over the last 12 months a digital weaning workshop where anyone from across the county can access. We promoted every contact. It's also available on all of our digital platforms, how to book. And it fits well with the agenda and the vision around the Healthy Weight Alliance and Joint Strategic Wellbeing Strategy. Key updates from school readiness. So we know that nationally school readiness, it's a focus for anyone that's working within the early years arena. We have embedded now the 2-year integrated review that was co-delivered and co-created with early years partners. Over the last 12 months, we've identified 160 children which have followed that pathway. That pathway is part of a joint pathway with early years where we will identify children, identify a lead practitioner and identify an appropriate plan for development to support that child through their journey. Preschool contacts we've also reintroduced, again, is a real positive, and they will commence from the 1st of April this year. This will support children to be ready for school. We will be completing these contacts from the age of 3 to 3.5, which will enable us to identify any delay in development and be able to support that child or appropriately refer to appropriate services. The preschool contact we've embedded to ensure that there's a safe transition between our health visiting service into our 5 to 19 sector also. So Relax Kids, this is an offer that we've introduced into the service, which is low-level emerging emotional well-being for children. This is a licensed programme and it is from the age of 4, and we'll be talking about this in a little while when we talk about the emotional health and resilience pillar. But what we've done is we've flexed this approach to look at demand of need of children, and we've co-created with the Family Hub something called Little Stars, which is an adaptation of the programme for children aged between 3 and 4. We are getting an increase in referral for children for low-level emerging emotional well-being from the age of 3. So this is something quite new. We haven't got much in the way of statistics at the moment, but we are getting a lot of referrals and identifying those children. So we've adapted and flexed the offer to meet that need. We are also in the process of developing a preschool toilet and workshop. This is following NICE and ERIC guidelines, so we're hoping that that's coming soon to the 0 to 19 service. And we'll be looking at the way that that's facilitated, really listening to service users to see if that would be possibly face-to-face in some of those areas, and obviously digital, as a lot of service user feedback we're receiving at the moment. They really like some of the digital offer that we're developing and delivering across the county. So just with regards to SEND, so in partnership with our early years and with the specialist SEND leads, we've developed quite a lot within the 0 to 19 service over the last 12 months. So we've got a notification to the local authority for Section 23 arrangements in place now. We follow the NCARD system. We are contributing to EHCPs on a regular basis. Staff have had training on level 1 and level 2 SEND with additional needs, as this was an area that staff did come forward with and said that they didn't feel confident with, so we listened to staff and we've provided national training. You can also see here that since the development of the EHCP process, there have been 317 requests to the service to contribute in quarter 1, quarter 2 and quarter 3. And we've produced 11 additional reports and returned them within timescale. You can see that from Section 23 notification, we've only got statistics from autumn 24 and spring 25, but that's the number of notifications that we've made as a service. From a parental wellbeing perspective, we have, or the Health Visiting Service have all now had the Institute of Health Visiting and Perinatal Mental Health training and emotional wellbeing visit training. This training's been embedded. Staff have gave really positive feedback, and we're able to support parents now around postnatal depression, listening visits, standardising those listening visits, really giving evidence-based support for those listening visits and being able to refer on to our partners as and when required. And you can see this is our last contracts data that I've put on there around the numbers of mums that we've screened as a service and the number of mums that we've supported. We're also working to look at inclusive for fathers. I know that Janelle leads a lot of this work, and where possible, obviously we're looking at simple things like making sure that when we're addressing letters, etc., fathers are inclusive, they're invited to all appointments. We're asking for fathers to have protected time to attend appointments, etc., to make the service as inclusive as possible. And also from a health needs assessment, we've now standardised our health needs assessment work, so we will ask fathers all the same questions that we will ask mothers as well. So our infant feeding pillar continues to grow from strength to strength. So we offer proactive calls to all mums that are breastfeeding, so from day 10 to 14 until the 6 to 8 week contact postnatally. We will offer them proactive calls on a regular basis, and we'll negotiate that with them. And over the last 12 months, there's been 601 infants supported through this process. So the service continues to offer antenatal infant feeding advice as well. So this is any infant feeding advice, but of course we are trying where possible to promote breastfeeding. But if a parent does decide that they wish not to breastfeed, we need to be supporting them to understand what is safe infant feeding. So the infant feeding team facilitate 9 weekly feeding friends groups. They're run across all of the county, and again we regularly obtain service user feedback to ensure that those groups are running in the right places. There's been 485 infants have been signposted to that group, out of those groups, by our service. And we continue to offer them home visits as well if we identify any infant feeding issues. The team support the delivery of the Henry Preparation for Parenthood programme also alongside the family hubs. And there are 14 new volunteers that have been recruited and are successfully or will be successfully trained very soon. The volunteers who are successfully trained are supporting some of the infant feeding groups, which is great, and are thoroughly enjoying that. And we have several volunteers as well who have come forward and would like further training. So the infant feeding coordinator and the tongue-tied practitioner with Northumbria NHS Trust are providing some additional training together and opportunities together, looking at development for staff. There's ongoing internal pathways being developed at the moment with the service, and we're looking at appropriateness of referrals. So the infant feeding coordinator has worked closely alongside the family hub as well, and they have completed a lot of joint training for partners, which has been really positive. And that's the infant feeding rates for Northumberland at this time. We are above the national average, which is really positive. But what we need to strive. We always want to strive better. We are doing a piece of work internally within Northumbria 0 to 19 service as part of Harrogate District Foundation Trust impact work. And one of the key drivers that we've identified is around the sustainability rate of the 6 to 8 week contact. And as part of that, we're putting together a local action plan on how we may be able to increase that sustainability percentage. And I'm sure we'll be able to bring some of that work going forward. Referrals into the service. So the service have been working closely with the Early Help Hub or the front door. We have a triage nurse that is based within the 0 to 19 service, but also works collaboratively with the front door. The idea of that triage nurse is all referrals that come in are triaged within 2 days. And the triage nurse will ensure that the referral is appropriate to come into the 0 to 19 service, but if the referral isn't appropriate to come into the 0 to 19 service, what service is appropriate for that child? Really to stop the delay and the bounce around the system around referrals. Data from the Early Help Hub indicates that, obviously, from the 1st of February until the 25th of August, as a service, we've accepted 267 referrals through that route. We do also accept direct referrals, and they are screened again by our triage nurse, and the direct referrals either come from social workers, paediatricians, or part of the care forward process, children in care.
So within our 5 to 19 offer, we have the public health pillar, and the team have worked really hard over the past 12 months to reduce the waiting times for children and families. So our current waiting time is 4 weeks. We offer interventions so one-to-one interventions with young people with a public health need. But we also have increased our visibility in education establishments and schools, and we offer Year 7 assemblies to make them aware around key public health issues and the offer that we have available to them in Northumberland. We have completed 9 over the past 12 months, and we're already planning for our next rollout, which will be around October, November of this year, and building relationships with schools, promoting what we do so they understand what the 0 to 19 offer is, so that we're working in partnership with the education providers. So that link with the school improvement officers is really vital to build that positive working relationship. We offer evidence-based bladder and bowel care, so that's tier 1 support using the ERIC guidance to guide us on that. We offer that one-to-one support, but we also have an offer that we reach out digitally so that it fits in with what families would like and how it fits in with how they would like to receive our service. We've had 78 children supported through the one-to-one support that we have, which has led to 101 initial assessments and then 303 reassessments. And again, it's looking at those key messages from ERIC, which is that evidence-based bladder and bowel care. We are continuing with our school health profiles. So we ask schools across Northumberland through profiling what their 3 key priority areas are for the next academic year. And in the last 12 months, we had 28 schools who engaged with that, and we received key targets around friendships, emotional regulation, oral health, smoking and vaping, and healthy lifestyles. In response to that, we offered and we developed packages of care that we offered virtually and face-to-face within those schools. We also worked collaboratively with a number of partners who offered that targeted care, so that we made sure that the messages, again, were evidence-based and appropriate to meet the needs of that particular school and that cohort of young people. We're in the development of a reception questionnaire, and this will be so that we can highlight those early interventions needed to improve the health and life outcomes for our young people in Northumberland, so that we can get the additional support in place for them and also signpost appropriately to the right service at the right time at the earliest convenience for those children. The public health pillar are also delivering on the National Childhood Measurement Programme. So we've just recently completed for the 2024-25 cohort, and we're pulling all of those data together, but we've also got the data that is from the 23-24 already in place. We feed that into the partnership meetings for NCMP, and then we are part of the Healthy Weight Alliance, which the NCMP figures are crucial to understanding the current landscape for our young people in Northumberland. One of our offers is around underweight targets, and we offer support to those families and have conversations. So in 2023-24, there was 56 health records reviewed. So we look at kind of the wider determinants and kind of those holistic approach to those children. Of those 56, there were 7 who were involved with another service and receiving that support. 27 families declined our offer, which is, you know, we need them to be on board with any intervention that we offer. But we offered them brief advice and that reassurance that if needed, they knew how to contact us and the type of support that we could offer. We also sent out support and information for them, again, to promote that health and well-being for that child. 12 engaged in health needs assessment, and that again was that holistic approach and supportive advice that we could offer those families. 9 didn't engage and 1 moved out of area. So we're busy looking at our cohort for this year and those proactive supports in place for those children. Within our emotional health and resilience pillar, we have a sensory pathway in Northumberland, and we've been working really closely with our partners to have that graduated response. So again, we're looking at those early interventions to improve those outcomes for those children. As Sam's already mentioned, with regards to the Little Stars, we have our 5 to 19 Relax Kids in Charge Up on a rolling programme. So our Relax Kids are for primary school children around those key early messages around low-level emotional health need, and Charge Up is for our secondary school. So we continue to kind of look at that. We use a lot of the feedback from the young people to make sure that we're designing and we're delivering an offer that is going to have the biggest impact, to give them the resilience to be able to build skills for dealing with emotional health. So we continue to use our digital platforms to promote that, and we've got a lot of the resources available to families on our Growing Healthy app, so that parents and carers understand the key messages too, so we're building that resilience within that whole family unit. We've been looking, within those programmes, we've had 81 children go through the programmes in the past 12 months, and we are looking at how we roll that out and develop that further, again, using that service user feedback to ensure that what we're offering is robust. We've had a total of 533 children referred and supported through our emotional health and resilience pillar. So that is with targeted one-to-one support around a number of those early emergent emotional health needs. Our referral themes, so in Q1, we saw a lot of secondary age children for that low-level anxiety work. But in Q3, in contrast, we have younger children, aged 7 to 9, and with a variety of emergent health needs, emotional health needs, and no kind of standout themes. We continue to look at what the data is showing us, because that means that we can adapt and deliver the support that's needed, and also support the workforce to have the skills to underpin all of that. Coming up after the Easter holidays, we are having a pilot of running our charge-up session. So again, that emotional health and resilience package over 4 schools in all localities. So we're going to place them in schools. Previously, they were in family health hubs, and we were inviting young people to attend to come and see us. We're going to adapt that because we've listened to the feedback from the young people and their families. So we're going to roll that out into schools. So we'll be evaluating that to see, what impact that has. A lot of what we do is based around the feedback that we're getting from young people.
We have the safeguarding pillars. So the safeguarding pillar, we've been influencing a 3-month pilot within Northumberland, really looking at the most appropriate children that we can support. So previously within the service, we were offering all children a health need assessment that came through the safeguarding route. So that was following a strategy meeting. What we identified was that we were ending up with a backlog of children due to demand, or we were working with children that didn't fit our criteria that we work with. So children with quite high level emotional mental health support, significant trauma. So we put in place a 3-month pilot. We met with our partners and we agreed to extend that pilot further, and that is due for re-evaluation at the end of April 25. So we're in the process of evaluating that pilot. So the pilot consisted of our service continuing to attend all strategy meetings for children, but actually at strategy meeting and following review of all of the information, identifying if that child, if we could offer any support for that child, were we the right health service, was there other health services that could support that child. So we're in the process of evaluating that at the moment. Early indication has shown that those children that are coming into our service are the right children. We're making an impact. We're able to provide the care that those children need. And those children who aren't are being referred into other services and again are being supported. But I'd be quite happy to feed that information back either in the next annual plan. And we are meeting with partners very soon to talk about the evaluation of that offer. As part of the agreement, what we have done is we presented the 0 to 19 offer, and that was within the learning portal for NCC, and that was an agreement following partner feedback. And since the pilot, the safeguarding pillar have prepared and contributed at all strategy meetings for 308 children. So we have attended 156 strategies since August 24 until March, though that data would be from. And there's been 98 children have been supported with a health needs assessment. They've captured the voice of the child. We've done levels of brief intervention. We've completed towards reports. We've attended conferences, and we've gave recommendations.
I think what's at the heart of our Growing Healthy 0 to 19 service is innovation and putting that best start in life agenda with measuring kind of health outcomes and the impact of our, our offer. So one of the exciting innovations that we've had is with regards to the Northumberland Housing Pathway. So we recognised that we're a home visiting service, and what we were seeing were home conditions, as we've heard previously from the previous presentation, that weren't conducive to health and well-being for our families, such as damp and mould, cold temperature, structural disrepair, and a complex system to navigate as families, but also a complex system for us as frontline health practitioners. So we using the HEAT tool that Sam's already mentioned, every practitioner that goes into a home for the first time will conduct the home environment assessment tool, and if we identify a need with regards to the home conditions, we created a full system approach across all sectors to identify where there's a need and to reduce the barriers around complex communication systems. So we use Northumberland Frontline as a platform to be able to quickly refer those cases to the right people at the right time for that early intervention. We ran a 3-month pilot, and during that time we supported 46 families, and we encountered a lot of issues within housing, whether that was damp and mould, which was what we were expecting to see, but also fuel poverty was a massive issue. We had issues around financial well-being. So we worked across all sectors, so the Citizens Advice, Northumberland Communities Together, and we worked as a collaborative to improve those health outcomes for that family, for those families. It was showcased at our HDFT Great Start in Life conference as an innovation to look at those building blocks for health, which we know that is key to those health outcomes. And we also showcased with Northumberland County Council at the Tackling Inequalities Through Housing event. Our next steps are looking at how we build on that success. So we're exploring with our research team to see if there's some scope and how we move that forward. Obviously, we want to be part of that warmer homes agenda and look at that climate change, because it all feeds in and supports frontline workers to be able to respond to what they're seeing and improving health and housing. Other areas of innovation, so we have baby boxes. This was supported by the North of Tyne Combined Authority and in collaboration with the Children's Foundation, where we gift baby boxes, which is to support our vulnerable families in Northumberland, where they will receive an array of items for their baby and for the arrival of their baby. Since we've implemented that, we've gifted 200 boxes across Northumberland, and we'll continue to do so across 2025. Hopes for Healthcare. So again, involving the voice of our children and young people is crucial to our service development and service improvement. Hopes for Healthcare were co-produced with a youth forum in Harrogate and District Foundation Trust, and it's a benchmark measurements that young people would like to see when they're being offered healthcare from our service. So what we've done is we've built upon that, and we've recruited young people. So the stipulation is they're 11 plus, and that they've had intervention of some description and had contact with our service within the last 6 months. We then use the key to Hopes for Healthcare, and we inquire and get feedback around what their experience was, what went well, what could we have improved. We also use that as an opportunity for co-creation. So during these, an example of that is during these youth forums, we explored a design for a poster for young people to let them know what our service offers, and they come up with ideas and thoughts that we wouldn't. But we're listening to their voice all the time, and that co-creation is really important to us. We've also had the opportunity to go to the parent panels with within the family hubs, and again that's about that co-creation with parents and carers, so that you know, their voice is crucial to that. So we're continuing with that. When we look at key achievements, so we've had lots of key achievements, UNICEF accreditation. We're really proud of the fact that we've gone through that gold validation. We're continuing to work with UNICEF to improve our offer around infant feeding, and that will be ongoing, but we're really proud that we've got that relationship with UNICEF, and that the service that our families and parents and carers are receiving are to gold standard. Within the emotional health and resilience team, we have the interface meeting. So that is a partnership between ourselves, primary mental health and SIPs. The idea is that we're having case discussions and we're making sure that we're getting the right service for our families and our young people at the right time to, again, reduce that bouncing between services. It's an opportunity to really explore what that young person is experiencing, what that family is experiencing, and make sure we get it right first time. So is it appropriate for relaxed kids charge up, or do we feel like it needs that higher level of emotional support? And again, we're looking at that neurodevelopment support and offer as well for that graduated response. Again, the right door at the right time. We're very much about looking at our future workforce. So we have the recruitment of our specialist community public health nurses. So in September 24, we had 5 newly qualified health visitors who came into post in Northumberland. So they experienced the training through Teesside University and have now been successful in securing those posts. We've also moved back to Northumbria University as well, so that's really a partnership that we're proud of as well. And we've got 5 students who are currently completing the programme. Our digital offer is our universal offer, and we've been very busy over the last 12 months growing that offer. The slide kind of explains how busy we've been because it is a busy slide. So if we look at our Facebook, I think that's where, understandably, our parents and carers get the messages. We know from talking to young people that's not where they're receiving their messages at all. But we have a great reach within that. We've increased our followers massively. So we've got over 100,000 reach on some of our Facebook posts. We know that we're sharing them. We monitor where the activity is and the types of information that parents and carers are responding well to, and we build upon that. We also utilise the public health campaign calendar so that we're promoting those key public health messages through our social digital media as our universal offer, because that's where we're having a great reach. Instagram, we introduced Instagram in 2024. That is slower to build, but again, utilising the feedback from our young people and understanding what they want to see from that. We're doing a lot of cross-posting, so they're receiving those key messages, but also looking at how we build upon that for engaging young people. So having those conversations, looking at how we promote that to them. We've currently had 20,000 views of some of the posts across Instagram, which again is a massive reach. YouTube is the latest to launch, and we share things across the whole footprint of HDFT, but we also have our Northumberland page within that as well, and we're building our own playlist within that. We've got our virtual weaning sessions, and again, it's about listening to those parents and carers and responding to the fact that we need to fit around their busy lives and when they're best to receive those messages, and they can access that as and when is suitable for them. So that's something that we're building on. Coming soon is TikTok, not to be missed. So again, we know that all of these platforms have different demographics, so we want to make sure that we're reaching that wider demographic and we're meeting the needs of our whole family. So we're in the process of setting that up, and it's quite an exciting development, and I'm sure sitting here this time next year we'll see kind of the impact that is having. We're really proud as well that we've become a distributor of SIM cards through the UK National Data Bank with Good Things Foundation, and this is about digital inclusion. We've got this universal offer, but we need to make sure that's accessible. So within the Good Things Foundation, we're promoting those startups with regards to educating around using data and digital offers safely, but we're also gifting SIM cards to make that accessible. We've gifted 20 SIM cards, and that continues for our most vulnerable families. So we're really proud of that. The app continues to grow. We've got our local offers on there. We've got the likes of the resources from Relax Kids charged up, as I say, so it's that joined up approach, that key messages. And within that, we've now got Recite Me, which is about accessibility. So we can adjust, the individuals can adjust the way it's displayed to match their needs, and that's whether that's background colours, size of font, you know, language, it can translate that. With the app, we've had over 6,623 downloads, which is fantastic. We've had 2,000 new registrations in 2024. Health Chat is definitely one of our successes within the app. We have a great use of that in-app texting and communication. So we have staff who man that on a duty, Monday to Friday, 9 till 5, and parents and carers and young people can text in and have a timely response to that, so that we're answering their questions, we're signposting, but we're also picking up any concerns and making contact with those families in a timely manner that's accessible to them.
So key challenges and area of development for us as a service. So our estate, so in Northumberland, obviously we have our estate strategy, which will continue this year. We're still working over what we class as our 5 localities, so all of Northumberland. Each locality has a main hub, and some localities have spokes, and we'll be continuing to rationalise those sites this year. Our child health clinics and the infant feeding groups that we currently run, we will be continuing to work alongside the family hubs and identifying other community estate sites to make sure that following service user feedback, we're running them in the right places for families. Our enhanced parenting pathway, we're continuing to work with partners with the co-creation and development of this, and we're hoping that that will start and develop this year. And also from a 0 to 19 Grown Healthy service offer in response to Health Watch. So we have been working with Health Watch in response to Health Watch. We are continuing to listen to our service users, especially around wellbeing clinics and the Feeding Friends at infant feeding groups. And that's some of the reason why some of those Feeding Friends groups have been moved into different areas. That's following service user feedback.
Thank you very much. Very comprehensive report. Lots of facts and figures as well. I think as a board, we are supposed to agree on the progress note. So before that, we are free to ask questions. So if you have any questions, please raise. Yes, please. Yeah.
Sorry, my query was just around the emotional resilience work that you're doing. So you mentioned sort of the interface meetings with SIPs and the primary care mental health. Are the mental health support teams involved in that work as well? That's one part of my question. And the second part is around, we know there's a massive increase in emotionally school-based avoidance now as well. So just wondering if that you have an offer around that.
I think the mental health support teams in schools, because primary mental health are part of the discussions that we have within the interface meetings, they take the lead on that element of it. So I suppose they're not directly in the meetings, but primary mental health feedback, if they can offer any support under that category. With regards to school avoidance, we aren't doing any work at this time, but there are discussions taking place with regards to that.
Thank you.
One question, please.
Thank you. There's very little to question actually because it's such a full report. But one that jumped out at me is right at the very end with your hub and spoke arrangement, the Hexham one. You've got your spokes in Prudhoe and Ponteel and Oaklands, but what about west of the county? Where's that?
So what we do, because that is such a rural community, it's such a big community, we utilise a lot of the family hubs. So a lot of the buildings in the family hubs, the likes of Holt Whistle. So if we have been doing some service user consultation around those areas, and we'll look at the birth rates in those areas as well. And if we had a big birth rate, we would of course, set up an infant feeding group or set up a child health clinic. But because we have our mandated contacts up there, we don't have anything up there directly right at this time, but it would be something that we'd consult on if we had a cohort of children up there.
Okay, thank you.
So we have staff that work in geographical areas for continuity.
Hub and Ashington hubs, they do not have spokes yet. Is it just that is never going to be one, or you are still trying to establish?
At this time, we wouldn't put spokes into those areas because it's such a tight community, and we have to look at obviously the travel, and because there's not a lot of travel involved for staff, we only have that one hub there.
Thank you. Thank you for your report. Just touching again on the interface with mental health services. So just to add, really, the feedback from our SIP service in Northumberland is of a very positive working relationship with you, and one that's developed over time. So within the SIP service, what they're reflecting is a reduction in referrals to SIPs as the offer within the 0 to 19 service has grown on the back of that interface and understanding what the kind of knowledge and skills needs is within the respective services. I feel like that's an incredibly positive outcome for our children and young people to be getting that early help and to not need to be referred on to secondary care services. And equally, those that do come into SIP service, the feedback from families around working with yourselves is very positive, and the feeling is this is a really good early help resource within the county. So thank you very much.
Thanks, Laura. That's actually really helpful, because when I was reading this report, people have used the word comprehensive, and when I was looking at it, I was thinking there's an awful lot of information about transactions here. But what that doesn't tell me is whether that's the right amount of transactions. So we could say, absolutely brilliant, you're doing so much really good work, you're using lots of evidence-based tools. There's more acronyms in here than I've seen in a report for a long, long time, to be honest, and some I don't understand. What I feel when I was listening that I was lacking was a sense of a flavour of the organisation that you are. There's not, until we got to the end, there wasn't a single story about a place in Northumberland. So are there communities in Northumberland where you find it really hard to have that preschool contact? And what are you doing about those? And how are you working with the neighbourhoods to do that? Now, you may well be doing that, but I'm not quite sure. And that's why having another partner in the room who says, yeah, you're working with us, you're a really good organisation when it comes to relationships. Because actually it's the relational stuff that I think a truly effective organisation is getting its relationships right, and also the relationships with your clients. And although you're telling us that you're getting feedback, and you do lots, and you're using all marvellous types of electronic stuff to get your feedback, it doesn't tell us what they're telling you. So for me, I really need some more qualitative stuff in the future about what you actually are doing and what's specific about Northumberland that makes it, and are you doing the stuff that we're all trying to do around the inequalities? And you mentioned that with the housing. And I know you do that, and the work with the fire service and everything else. But a comprehensive report, loads of transactional stuff. But could I understand more about the qualitative stuff in the future, please? Thank you.
Yeah, we can absolutely add that. That's not a problem. I take that completely on board. In our next report, we can absolutely add that, because we do have really positive relationships with partners, and Yeah, we probably, you know, I do apologise if that hasn't reflected through, but we can certainly do that.
I'm really glad that you kind of acknowledged it, because this is the kind of feeling I also had, because you may have sussed out in the previous presentation, inequality, tackling inequality is very central to us, and that's a very place-based. We also make sure it's a very place-based as well, because we have to be. So therefore, if you could bring in, I mean, you are doing a fantastic stuff. Like the heat, I was really impressed with that one. You're going around and looking, I mean, you know, looking at the houses, see whether they are environmentally safe. These are very good work, but we would like to see that map somewhere. And I think it would be nice. What I really felt was there were lots of information, and, you know, it's difficult to capture. So if you could give a kind of a structured organization or something, organization of the material in the form of some kind of a tree or something like that. I mean, tree means mathematical tree. I mean, I don't mean that. I mean, in a structured way, that would be much more helpful as well to appreciate and then follow it up. Thank you. Anyway, I think the point, I emphasize the point. Any other questions? Yes, Peter. And then.
Yes, thank you again, and thank you for the Health Watch shout-out in the report. I just wanted to echo Graham's question slightly, and ask two things. Could you say a little bit more about how the mandated contacts work, and how confident you are that they're getting you contact with all the young folks and families that need contact? And secondly, is there any insight from your analysis of your digital offer that gives you a flavour or a feel for how well your reach is, or how appropriate your physical reach is?
I think the mandated side of it, obviously, we follow the Healthy Child programme, so we have a really good percentage rate, as in contacts with our families. And we listen to our families as well. So, you know, even though we have timescales, there are occasions where they're not appropriate within those timescales. So we will obviously try and meet those timescales. But ultimately, it's about communication with the families and meeting them with their needs. So mandated offer, obviously, is we offer an antenatal visit, a primary or a new birth visit, a 6 to 8 week. We now are offering the 3 to 4 months, the 9 to 12 months, a 2 year, and a preschool contact. So that's where our mandated offer is. From a 5 to 19 perspective, we don't have a mandated offer within 5 to 19, but we have the pillars. So obviously it's a referral in service and a targeted service.
With regards to the digital, what we have is a very enthusiastic digital champion role within our service. So across the whole 0 to 19 service and across each locality and we're thinking of that place-based, we have a representative who is aware of the needs of their community, and they use the platform to be able to promote those positive health messages. We're also promoting messages from partners, because we want to show that we're a collaborative approach. So if there's an event in a community, that will be posted across our socials. We have those key public health messages and those campaigns that we're promoting all of the time with those messages. But we're also putting on, where we get a lot of engagement with our families is when we ask them to interact with us. So that we've got different tools and different ways to engage them, have that interaction, have that feedback around what they're interested in, and then we build upon that. So our digital champions meet really regularly, where we look at those trends and we build upon that, so that we know that those key messages are going out, we're localising it, but we're also getting those public health messages at the same time.
So in a sense, your digital footprint will very much reflect your physical footprint.
Yeah.
You want to come in?
Yes, thanks. Another excellent report, and I think it's a really excellent example of using that contact that you have with families to try and unearth kind of what those issues are and what support's needed, and then obviously using Frontline is brilliant to be able to refer them where it's needed. I think the same point that I made before, which is really about it would be really beneficial to have a cohesive way of reporting, because when you come and report to Health and Wellbeing Board, there is that impetus on reporting your statistical impact, which can feel transactional. But I think the challenge on us, you know, because we have moved so far as a board, is to think about a way of being able to report that the real impact, but also the real work that's done and where it's happened at a collective level, because that's how we're really going to demonstrate the impact it's had on people, and also what the work that is required to undertake that through every, you know, at every level. Thanks, Chair. Thanks for the report. It is a robust descriptor, but I know we've already talked about impact, outcome, and tackling inequalities, and how much we can evidence that over a retrospective view of the last 12 months. And also, I think the work that we will launch from Institute of Health Equity will help us with that a lot, because we know from the outside looking in, Northumberland can look like a really good place to live, and it is, but what is masked quite often is the within county inequalities. So if you have the example of the breastfeeding statistics, we could be inadvertently widening inequalities, even though as a percentage increase, we are doing better on our 6 to 8 week continuing to breastfeed. But who are those mums? Because if it is only the more affluent mums, then we are widening our inequalities. So we're not assured as a board that we are doing the work that we are set out to do, which is to tackle inequalities, unless we see the evidence of that. And then the other bit around universal through to targeted, when we talk about working with 28 schools for school health profiles, we've got 160 plus schools. So I suppose a question for me is, are they self-selecting schools? Are they deliberately targeted schools? And therefore it's absolutely right and proper to only work with 28 schools. And I know you know this, so I think that's the bit that we need to see better reflected in the reports going forward. But it's great to see that the work that is happening, and brilliant to hear the positive relationships with mental health teams and such like. So great work, and I think we've got a lot more to do to demonstrate that through the evidence and impact.
If there are no more comments, can I propose we agree the recommendation and then say we gave you some feedback which has been acknowledged. Thank you. Thank you very much once again. Yeah. Note the forward plan, they are mostly empty because they'll be flushed out after the election, but the take-home message is on 25th of June, correct? Yeah, there is a closed session tackling inequalities through employment, if I'm right. Yeah. Okay. And yeah, okay. Sorry, you want to come in?
Are you finished, Chair?
I just want to go to urgent business and congratulate.
Okay, fine. You do that, and then I'll do my bit of business.
All right. Okay. So there is no urgent. It's an old news. You might have heard about it. We had an Ofsted inspection on our adult social care services, and we have been rated good. That's because under the leadership of Neil Bradley here, they have done a fantastic job, I can tell you. So because it has got some relevance to this board, I thought I will re-mention it and congratulate Neil as well. It's a very thorough inspection, because I was interviewed by those inspectors, and it was a grilling interview, actually. I think Neil prepared me very well. They really asked me tough questions with smiles on their face. And I answered most of them, and I fired some of them equally with a smile. So I am personally pleased I didn't rock the boat. So congratulations again, and keep up the good work, and keep the good work, all of you. Thank you. Yes, you want to say something?
So that's really replying to you, Paul. So it's to acknowledge the elections that are coming up, and to say thank you very much to all the elected members that have contributed to this board over the last few years. You've all shown a real interest and a curiosity, and I think you've pushed us along, you've taken hold of things. You've thought carefully about how to introduce different aspects of it. And actually, I think all of us have found it's been a really good experience, I think, in terms of what we've done with the health and wellbeing strategy. So thank you. And then a particular thank you to Paul for his chairmanship. We have preparation meetings before these with Jill and I and Veronica, and he's always incredibly keen to make sure that he's got a grasp of the issues that are coming and to think about how we're going to make the best of the agendas. So thank you all.
Yeah, that was my tuition by my vice chair. Tuition sessions, tutorial sessions before I come into the meeting. Okay, thank you very much, all of you. This brings to the end of this meeting, and I wish you all the very best on whatever you do. Thank you.